I want to start by expressing my appreciation to all of my colleagues who are joining me here on the floor today and thank them for all the work they do every day for women and their health care. Mr. President, as of last week, the CDC reported nearly 900 cases of Zika here in the United States and 3 U.S. territories, including actually 2 confirmed in my home state of Washington. A recent survey showed that 40% of adults in the United States see the Zika virus as a reason to delay starting a family. And like so many of my colleagues, I'm hearing from women across my state who are very frightened about this virus. They want to know how to travel safely in light of Zika. They want to know whether they should wait to start their families. And tragically, I am hearing from expecting mothers who are concerned about what this virus could mean for the babies they have on the way. Mr. President, women and families at home and abroad need Congress to take action against this virus, to help raise awareness about its impacts, to expand access to contraception and family planning, to improve vector control, and to accelerate our efforts to find a vaccine. That is why, for months, Democrats have urged Republicans, come to the table, work with us on making sure we put the needed resources into this fight against Zika. Now, the administration put forward strong proposals, but Republicans refused to even consider it. And while some in the Republican Party indicated last week they wanted to work with us on an emergency supplemental funding, it has become pretty clear that unfortunately they've been beaten back by the extreme right wing who doesn't want to do anything at all. These extreme conservatives do not recognize that Zika is an emergency. They don't want to give our administration a penny more. And as a result of that delay, we are behind the 8 ball as mosquito season comes this summer. That is why we have come to the floor together today to send a very clear message to Republicans today. We need action now. Women simply cannot afford to wait, and they should not have to. Mr. President, Democrats are ready to get this done as soon as possible. And for families and communities who are looking here to Congress for action, I hope Republicans join us now so that we can deliver what families are asking for in our country. Thank you, Mr. President. I yield the floor.
Mr. President.
Senator from Massachusetts.
Thank you, Mr. President. I want to start by thanking Senator Heitkamp for pulling us in here today to talk about this emergency, and Senator Murray for her strong voice on this, and many others who will be speaking today. In 2014, Ebola broke out in West Africa. As it advanced, the international community came together to combat the outbreak. Doctors from around the world traveled to West Africa to set up emergency hospital units to help the sick and to attempt to contain the virus. President Obama deployed thousands of troops to support the effort. With the media focused on the outbreak right in the middle of the 2014 elections, Republican senators and Republican candidates across the country seized on this global health crisis. No, they didn't swoop in to the rescue. In fact, Republicans did nothing to support the actual Ebola response before the elections. Instead, they terrified the American people with totally made-up stories of Ebola-infected immigrants coming across our southern border. They loudly trumpeted a number of dangerous and irresponsible solutions like travel bans that would actually make dealing with the problem more difficult. Ebola ravaged West Africa, but only 4 cases were ever diagnosed here in the United States. Republican politicians didn't care. They had found something to blame on President Obama and the Democrats, and they were happy to do it. They exploited the situation to help win an election, and it worked. Now, not all of the fear-mongering candidates won, but most of them did, and they won in part because they promised to protect the American people from these horrible, contagious diseases. Today, Republicans run the Senate, And we face a terrible threat right here in America, the rapidly spreading Zika virus. So I come to the floor to ask a simple question. Why haven't Republicans lifted a single finger to stop it? Unlike Ebola, Zika isn't confined to one small region of the world. It is already spread across most of South America and through Mexico. Unlike Ebola, which can be transmitted only by direct contact with bodily fluids, Zika can spread rapidly across distances by transmission through mosquitoes. Unlike Ebola, our leaders at the NIH and CDC are raising the alarm that Zika is an imminent threat to Americans. Nearly 900 cases of Zika have already been reported on American soil. Zika can be devastating. Most people who contract Zika show no symptoms or only very mild symptoms. But Zika infections can trigger Guillain-Barré syndrome, a condition in which the body attacks its own nervous system, which can cause permanent and severe damage, hospitalizing some people for weeks and killing others. In addition, babies born to mothers who were infected with Zika may suffer severe and permanent brain damage. The World Health Organization estimates that 4 million people, 4 million, could be infected with Zika by the end of the year. The threat is real, but where are the Republicans? For weeks, Senate Democrats have called for emergency supplemental funding to support public health efforts, both in research and prevention. Republicans have done nothing. For weeks, the president has called for emergency supplemental funding to protect the American people. Republicans have done nothing. For weeks, leaders at the WHO, NIH, and CDC have begged Congress for resources to fight this disease. Republicans have done nothing. The president has been forced to divert funds intended for work on Ebola over to work on Zika. Now, that's a very short-term strategy. Ebola has dropped out of the news, but the threat has not ended. We need funding for work on both, but still, the Republicans have done nothing. And now, Senate Republicans are taking us on a week-long recess. Where is the Republican plan to fund the Zika response? Where is the Republican plan to replenish the Ebola funds? Apparently, when there's no immediate political benefit, the Republicans can't be bothered to act. Forget Ebola, forget Zika. They want to go on vacation. Well, I have news for my Republican colleagues. That's not good enough. You won the election by telling Americans you would protect them from scenarios just like this. You run the Senate now, so it's time to govern. There is a public health crisis bearing down on this country. Babies will be born permanently disabled, and families will be devastated if you keep blocking funding to deal with this problem. It is up to you to act. This is what government is for, to help protect the people of the United States from serious threats, from real threats. The Republicans are failing the people of the United States. Thank you, Madam President. I yield.
Madam President, the senator from North Dakota. Least anyone think they're immune or that this is only about the tropics. I don't think a lot of people in the United States of America would call the state of North Dakota the tropics. I hold up today the first noted case of a pregnant woman who's been infected by Zika. She was traveling, probably bitten by a mosquito, somehow contracted the Zika virus. She will now live in fear that the baby she's carrying will suffer the birth defects that we know are associated with this potential pandemic. Where's the answer for her? The answer that the North Dakota epidemiologist gave for her, which is good advice, is don't travel anywhere where we have Zika virus infections. I guess she's not leaving her house because the way this is spreading and the way this is moving, that will be everywhere in the United States of America. And once it migrates and once it moves, What's going to stop it? And who's going to stand on the floor of the United States Senate and take responsibility for the lack of action, for the lack of responding to this public health crisis? That's why we're coming here today. This isn't about politics. This isn't about a public health emergency. We need resources, we need answers, we need tests, and we don't need to rob from other potential pandemics like Ebola to get this done. There isn't a citizen in the country who wouldn't say this is an obligation of the government to protect their people. We anticipate in Puerto Rico, a territory of this country, a lot of people travel to and from Puerto Rico, 1 in 5 people in Puerto Rico will be infected by the Zika virus. Do they know it? Probably not. Frequently, no symptoms come with the infection. So now we have to respond. Now we have to do what's right. And people will say, it's not, we can take this in regular order. That's what I hear is happening over in the House. They want to take this in regular order. Well, if it is a regular problem, why has the state of Florida declared a state of emergency? In February, this is not new. It's estimated that Florida will continue, as the Zika virus migrates, continue to be the next big place of infection. What does that mean to Florida? Not only does it mean that you have created huge insecurity for the families, particularly young women, the age of our children, who are now thinking about having babies, you created huge insecurity. If the answer is don't have babies, how many generations do we have to go? We don't know. That's the problem. We don't know. There is no test. There is no way to verify at this point, no rapid test. So when we look at this and we look at the effect that it's having, not only on our families and on family decisions, but you look at the effect that it is having on tourism. We all know that the Caribbean depends on tourism dollars to have stable governments. We all know that Florida is heavily dependent on tourism. People in my office have already canceled plans for Caribbean vacations. People I know have already canceled plans to go to Florida because they're afraid. What happens when everybody is staying home because they're afraid? This is not something that we can play politics with. This is something that should unite all of us. We should all be coming together. And if you don't like the president's plan, tell us what's wrong with it. Tell us what you need to change. Tell us what your experts, contrary to the experts at CDC who have arrived at this plan, tell us what your experts think needs to be changed and what level of accountability you need. This morning, I understand the argument isn't that we shouldn't spend the money. The argument is there's no accountability. Tell us what accountability. Come together. Let's solve this problem. Let's rise to the occasion here in the United States Senate. When confronted with this virus, let's come together. Let's show the people that we can respond. And I don't think that I'm exaggerating the potential health care effects. The World Health Organization has declared it an emergency. Conservative governor in Florida has declared it an emergency. And certainly for this young North Dakota woman, it's an emergency. She needs to know, and her family needs to know, exactly how this virus is transmitted and what she can expect going forward. And so she's just one of the first cases. My great friend, the senator from Washington, not exactly the tropics, in the state of Washington as well, also has one case, and we don't know how many more. We don't know how many more. And so I am pleading, let's not wait. Let's treat this like the emergency it is. Let's do what we need to do to protect American families, particularly young women of childbearing age who are going to be devastated if this happens in their family. And so let's do the right thing. Let's come together. If there is a problem with the proposal, let's debate what that proposal should look like. Let's bring it to the floor. Offer amendments for accountability. Why are we waiting? Someone needs to answer that question, not just to me, but to the American family and the American people. With that, Madam President, I yield the floor.
President.
The senator from New Hampshire.
Madam President, I come to the floor today to join my colleagues because I share
There are very real concerns about the impact of the Zika virus on families in New Hampshire, also not a tropical state, the impact on people across the country here in the United States, and also on people around the world. You know, as has been pointed out, we've seen reports from regions with active mosquito-borne transmission of the virus, places like Brazil, where they're about to host the Olympics, and people will be traveling there from all over the United States, from all over the world. We've seen those stories of women who have had children with severe birth defects, with microcephaly, as a result of their exposure and contracting of the virus during pregnancy. And we've also seen impact on adults. The connection that seems to be there, and I think we're still waiting on definitive research, but the connection on adults between the Guillain-Barré syndrome and the Zika virus is also very real. And while fortunately in America, in most cases, that can be treated, the reality is in a lot of places around the world, and for some people, it causes severe paralysis and sometimes even death. So this is not just something that affects pregnant women, but there are also concerns about who else might be affected by this virus. And as we've heard from North Dakota, as we've heard from other states, as mosquito season arrives in this country, we can expect additional Zika cases transmitted often by mosquitoes from tropical areas that people contract when they are traveling. But we know that this mosquito is coming to America. In New Hampshire, where neither of the two known mosquito vectors currently live, we've already had 3 cases of Zika, with about 150 possible cases that are still being tested. Now, 2 of these cases were acquired as the result of traveling to Zika-impacted regions, but the 3rd was contracted because of sexual transmission of the disease from a partner who had been traveling. And, you know, last week I chaired a roundtable on Zika in Concord, New Hampshire, in our capital, and we had representatives who are looking at what might happen with the virus and are planning for an outbreak, which we hope we can avoid. So we had doctors from the state, we had the state epidemiologist, we had the director of the state lab, we had people who are working on mosquito control, and they talked about how over the last several months they've been getting more and more questions about Zika, particularly from women who are planning to have children in the near future, and for pregnant women and their families, or women and their partners who are beginning to think about starting a family. The threat of Zika, as Senator Heitkamp pointed out, is very real. We had one of the doctors and obstetricians at that roundtable who reported that many of her female patients are canceling vacations that they had planned, and that some of her patients whose husbands are in the military, who are stationed in Zika-infected countries, are concerned about how to protect themselves and what they need to do when they return. We heard from folks at our New Hampshire Department of Health and Human Services who talked about the importance of increased access to family planning and contraceptives, and the Zika outbreak impact on the need for those services. It gives us a new lens on the importance of making sure that women and families have access to this health care. We need to make sure that all women at risk or diagnosed with Zika have access to comprehensive, patient-centered contraceptives and preconception counseling. We also heard from the folks involved with mosquito control. What they told us is that there are 2 mosquitoes who can spread the Zika virus that we know of at this time. One of those is a mosquito who is only in the tropics, who we're never going to see in northern New Hampshire and in northern New England. But the second mosquito we've already found in Connecticut and Massachusetts. And the mosquito control folks said that unlike the usual spraying for mosquitoes, which is in wetland areas and swampy areas in New Hampshire, that this is a mosquito who, as Secretary Burwell has described it, can breed in as little as a cap full of water, cap, C-A-P, full of water. They are mosquitoes who bite people 4 times in order to get a meal, so they spread very fast. And what we heard from the mosquito control folks who were at this meeting was that they're encouraging people to look at places in their yards where water might collect in small spaces, in wheelbarrows, in paint cans, in places that we wouldn't normally think about mosquitoes growing. They also encourage people to think about protecting themselves. When you're going out, about covering up, wearing long sleeves, wearing slacks, wearing socks, when you're outside at a time when mosquitoes might be around. The other concerning thing about the Zika mosquito is that it also is active during the day. It's not like most of the mosquitoes that we see in New Hampshire, which are active at night. This is a mosquito who's also active during the day. So we need to be taking action now. I listened to the head of the state lab in New Hampshire talking about the challenge of getting results from the lab for people who had been tested for Zika. And he said, you know, sometimes because we have to send out to labs that we don't have the capacity in New Hampshire to do the analysis that's required, we're still looking for a test that can definitively determine if somebody has had Zika in the past. He said, something as small as the ability to ferry the samples and the results back and forth to a lab is one of the things that we need so we can get answers so we know how to act. The folks who are trying to get information out to the public talked about the need to have support so that they could get information out both to the medical community and to individuals about the importance of what individuals need to do to take action. And they said very directly to me, as I said, you know, I appreciate that this is something that we need to work with you on in Washington. They said, you know, we don't have the resources to respond to this in the way that we need to in New Hampshire. And for those people who would say, don't worry, you know, you're exaggerating, this is never going to come to New Hampshire. Well, that's what they told us about the West Nile virus, and that's what they told us about EEE. And we've had deaths in New Hampshire in recent years from both of those viruses. So I think we need to act on this. I know that there's been an agreement in the Appropriations Committee among the appropriators on both sides of the aisle. It's been a bipartisan agreement to help get a supplemental funding bill to the floor to address this, because in New Hampshire, what I heard is that we need help. We need you in Washington to help us. And if we're concerned about the cost of this, just think about what our inaction will do. What if we have an outbreak and we have people we have thousands of women, as they do in Brazil, who have been infected and who've had babies with microcephaly? What are the healthcare costs to people who might have been infected by the Zika virus, with Guillain-Barré syndrome, with other birth defects as the result of being infected during pregnancy? So this is a bill that we can't afford to wait on. We need to address this. If folks are not willing to do it because it's the right thing to do, they ought to be willing to do it because it's the cost-effective thing to do. So, Madam President, I hope we can come together. I know people on both sides of the aisle here are concerned about this. We need to come together. We need to address this. It is a pending public health emergency, and we've got to respond. So, thank you very much. I yield the floor.
Madam President.
The senator from Hawaii.
Madam President, I rise to join my colleagues in raising awareness about the Zika virus and the need to pass the President's emergency appropriation request to get ahead of this crisis in the making. Some question the need for this emergency appropriation request. Perhaps those who believe that funding the president's request is a waste feel that we are not at immediate risk. But you've heard my other colleagues talking about how this is an impending crisis. So while Zika may not seem like a threat in the United States now because we have not hit peak mosquito season, this head in the sand mentality is irresponsible. Zika is ravaging South America, which is having its summer right now. Zika is on the move. The mosquito that is the main Zika carrier is already in 13 states. And another mosquito also capable of spreading the Zika virus is in 30 states. As families travel this summer, they will be moving in and out of states and countries impacted by Zika. So to my colleagues who aren't worried about the spread of Zika right now, it's time for all of us to wake up. With summer comes mosquitoes, including, of course, the mosquito carrying Zika. And we must do all we can to ensure that Zika does not gain a foothold in the United States. Let's act, not react, to this Zika threat. This means funding the president's $1.9 billion request for Zika. Hawaii knows firsthand the impact of vector-borne diseases like Zika and of the resources and effort it takes to contain an outbreak. 7 Hawaii residents have already been diagnosed with Zika. 1 infant born to a mother with Zika has been diagnosed with microcephaly, a devastating birth defect. On top of that, Hawaii has been dealing with an outbreak of dengue fever, which is spread by the same mosquito that carries Zika. The dengue outbreak in Hawaii began in September, and only yesterday were we able to go 30 days without a new dengue case. The unique location of Hawaii means it serves as transit location for many Pacific Island nations where Zika outbreaks have occurred in the recent past, places like Yap and French Polynesia. We know this disease can migrate and that it can migrate quickly. That's why we have to get ahead of it. Having the administration shift Ebola funding around is not the answer. That is akin to robbing Peter to pay Paul. What will we do if Ebola also has a resurgence this summer? Shift money back from Zika? The United States is in a strong position compared to many other countries to fight Zika. We have in development vaccines, blood screenings, cleaning tools, and research that will be game changers. When the president sent his $1.9 billion request to Congress, he laid out how the funding would be spent or used. It would go toward vector control, public education campaigns, and vaccine development. It would go toward the work of companies like Hawaii Biotech, which is racing to complete work on a vaccine. We must fund the emergency request so federal agencies that stand on the battle lines of combating disease can do their work. We must also strengthen vector control programs and emergency preparedness programs. It's imperative that we give our communities the tools they need to fight Zika. Time is still on our side right now, but time is running out and we must act quickly. Let's come together to ensure that Zika does not become a full-blown public health emergency in the United States. Let's fund the president's request. I yield the floor.
Madam President.
The senator from Minnesota.
Madam President, I rise today to discuss this urgent public health emergency. I'm honored to be here with Senator Murray and Mikulski and Heitkamp and Hirono as we look at this serious crisis facing our nation, and that is the Zika virus. The World Health Organization has declared that Zika is spreading explosively and will affect nearly all countries in North and South America. The virus has already infected nearly 400 Americans who have traveled abroad from 40 states, including my home state of Minnesota. Over 500 people in Puerto Rico have the disease. Nearly all of them contracted the virus locally. These numbers will only continue to grow as the warmer months bring more mosquitoes that transmit this disease. In fact, researchers calculate that 60% of the people in our country live in an area that will likely be affected. Zika is a rapidly evolving mosquito-borne virus. Most infected patients develop mild flu-like symptoms that last for a week. However, the virus has devastating consequences for growing families. Researchers have now confirmed what many feared was true. A pregnant woman infected with Zika is at risk of giving birth to a child with microcephaly. This heartbreaking, lifelong condition results in newborns with abnormally small heads. These children will need increased access to health care and developmental services, speech, occupational, physical therapies. There is no known cure for this disease or even standard treatment for this condition. It is crucial that physicians have the knowledge and tools essential to diagnose and care for pregnant women who may be infected with Zika. It is crucial that moms with Zika and children with microcephaly have access to the services they need. It is crucial that we take steps now to ensure that our healthcare system and all levels of government are prepared for the imminent spread of the Zika virus. We are here today to continue to stress the urgent need to ensure our country is as prepared as possible to mitigate the spread of Zika and respond to outbreaks of this virus. The administration submitted a request for nearly $2 billion in emergency funds to provide immediate support. This is about research. This is about a vaccine. This is about therapeutics and diagnostics. This is about a medical health crisis that primarily, but not only, affects women and children, and that is why the women Democrats of the Senate have gathered here today to speak out and say, this is a crisis that must be funded. This is a crisis that must be responded to. And simply because it mainly affects women and children right now, and we have no idea what other effects it will have, this is no reason to shirk our duties in the Congress and not fund this. Our foremost duty is to protect the health and safety of Americans. Zika is a rapidly evolving disease with severe public health implications. I ask my colleagues to support this effort. We cannot afford to delay action. Thank you, Madam President. I yield the floor.
Madam President.
The senator from Maryland.
Madam President, I rise to take the floor as the Vice Chair of the Appropriations Committee and really urge that we adopt an urgent supplemental request to deal with the Zika threat here. This is real. It's been 2 months since the administration sent to Congress an emergency supplemental. We can't wait any longer. The mosquitoes are here. They're actually here. They're here in the United States of America. And I've said, first with wit and now with deep concern, you can't build a wall to keep the mosquitoes out. The mosquitoes aren't going to pay for this. We need to act, and we need to act now. This is a compelling public health crisis, and we can do something about it. We take an oath to defend all Americans against enemies, foreign and domestic. This is about to be a self-inflicted wound on our own people because of our failure to act with known, reliable, tested public health interventions on mosquito control. We've got to take action to do this. And why? Because as of April 20th, there have been close to 900 cases confirmed in the United States of America. We already know that they're in 3 states. CDC knows that it is going to come to at least 30 states in our own country, and it will have incredible consequences, particularly to women. Now, I have heard over the years many eloquent, poignant, and even wrenching speeches about protecting the unborn. And they've been deeply moving. We've tried to always find common ground on this. But if you are really for defending the unborn, you've got to pass this supplemental. There are women all over the United States, particularly in these 3 vulnerable states. There are women in Puerto Rico who are wondering if they're already pregnant. What is their situation? There are young women and not so young women who are concerned about getting pregnant, at the same time bitten by a mosquito for which there are sparse resources to do mosquito control. Now, we want to build fences to keep out illegal aliens, okay. We want to bomb the hell out of ISIS and terrorists. We should, because we're worried that they're coming at us. But in many of those instances, these are problems that have been difficult to solve. This is not difficult to solve. This is about mosquito control. And I am very concerned that we are just sitting around, that when all is said and done, more is getting said than gets done. We are talking about an emergency supplemental. Now, the Appropriations Committee has a very clear set of criteria for what is an emergency. First of all, it has to be urgent. Well, the mosquito season is here. It has to be unforeseen. This was unforeseen, and it's temporary. It's mosquito season. It is a confined season, and we can do something about it, and we must do something about it. It will have a disproportionate impact on pregnant women and the unborn. Children born with the most horrendous, heartbreaking birth defects. You know, I'm of the generation that was the polio generation. My mother wouldn't let my sisters and I go swimming until after June 20th because somehow or another it was in our faith St. John's Day, and we thought the water would be warmer. Maybe the saint blessed the water. God bless the saints. But God bless people like Dr. Salk, and God bless America that funded the Salk vaccine. But I remember children in iron lungs. Children in iron lungs to be kept alive. Children with braces, and then walked with these very difficult canes. And some of them those who survived, bared this the rest of their life. Look at what we're facing here. And we know it. This is not unknown, nor is it unmanageable. It will be a national disgrace if we don't act. Now, in my own home state, I have a Republican governor, Governor Larry Hogan. And guess what? Governor Hogan's acting. This isn't about Democrats or Republicans. Governor Hogan acted. He declared April 24th through the 30th Zika Awareness Week, and he's been ordered his health department to coordinate educational events with local health departments. They also spent $130,000 of state money to develop 10,000 transmission kits to begin to deal with this. My Republican governor has taken action. Then also in Anne Arundel County, the county that's the home of the state capitol, again, headed up by a Republican county executive. They've received 850 kits. They're going to have town hall meetings to talk about health and agricultural with the agricultural officials on prevention and mosquito control. Republican governor, Republican county executive, acting. Then there's a county called Howard County, where the health department is planning to distribute 450 kits to obstetric and gynecological practices to protect pregnant women. Again, a Republican county executive working with his administration is taking action, spending local money when this is a national problem. So I sense this because my own governor's acting, these county executives, and then in Baltimore City with a Democratic mayor, she listened to the warnings coming from the World Health Organization, the CDC, and the Bloomberg School of Public Health in Baltimore, and has again taken action where Baltimore is now spraying and taking mosquito control efforts and so on, spending over $500,000 of local money for which we don't have a lot. So, hello, Maryland is acting. We need to act. So I say this because we're spending local money to deal with the national and international problem. So please, let us now, whatever differences we have on other bills, please, let's take up this urgent supplemental.